in the best way. We pray for peace and blessing over this time and for the ability to absorb the things we need to absorb and walk out of here with. We are grateful to you, Creator. In your name we pray, amen. So I'm going to ask for some participation right now. We'll need a microphone. We're going to just start with some bold folks who can share something you're taking away. I've heard folks have come up to me, which is very helpful. We'll be sending out a survey, which will be helpful. Last year, you guys did a great job of responding. But I'd like, if you guys would like to share with each other kind of what you're walking away with, either something that was great or something that, what you're walking away with. Can we get a mic over here? Thank you. Right over here. So a takeaway.
Good morning. First of all, I'd like to thank Director Michelle for all her hard work and all the corporations that have come here together to give us information about digital health and what we can do. What my question and takeaway is, even with all the information, which was great, is how does that work for the actual provider or practitioner that's practicing day to day, going through the day-to-day challenges of meeting the health needs of their patients? They're overworked, they have minimum resources, they don't have the finances. How do we bridge this gap between the corporation and the initiative of the USVI government to help these physicians, boots on the ground, to make some of the changes that we're looking forward to having in the Digital Summit?
Yeah, thank you for that. I think one of the first ways we do that is through having these conversations and being able to hear. It's very hard, actually, when we're not gathered in this way, to hear from especially our small private practices, because no one agency, even Medicaid that's got over 1,000 providers, doesn't have the ability to sit with each one to understand their issues. And there is funding available through Medicaid. There's funding available through grants. So having conversations like where we included conversations about funding is one way where some part of it is being illuminated, folks in the room being illuminated to, we need to connect with VINGN, we need to connect with Department of Health on a grant they're working on, we need to connect because there is a gap between what we're doing in our day-to-day practice, treating patients, and I don't even know what federal regulations are out there right now that I'm supposed to be abiding by. So part of this is to be the forum to say, alert, there are a number of funding streams, there are standards to be aware of, there is support. Like with Southeastern Regional Telehealth Center, a lot of folks didn't know that private practices can take advantage of them, or CISA having free resources. So I think it's keeping these conversations going. From my office's perspective, it's after this summit continuing to meet with providers as well to bridge that gap between what's happening in the public sector and what's available in the private. But that is a challenge, again, because each practice has different needs too that are different than the hospitals and the FQHCs. So I think it's something we all have to work together, and I don't know if there's anyone else that might want to respond to that. But I think I walk out of here with more information and more understanding. I had a provider speak to me this morning to say that the conference, as much as the information is great, the ability to meet with some of the vendors directly. It's her only FaceTime with them. So knowing that that's valuable helps in the future. But also she made a good point about education of patients. So this was brought up yesterday. as humans, we have a strange dichotomy on our thinking and stance about things, and this is everyone. Because certain industries have conditioned us to convenience, we don't think about security because I need the convenience more. So when I enter all my information because I love my music streamed, I'm not worried. Who knows? I've never seen or spoken to anyone at Apple, but I had no problem putting all of my banking information, and if they had asked for how many kids I had and what my social was, I would give it to them because I want my music streamed. And we do that naturally. But then healthcare and education tend to be behind the technology 8-ball, and so we're conditioned in a different way. And so then we have fears that we don't have with Apple, where it's like, I'm looking at you, provider, and I'm used to seeing the piece of paper, and now you're telling me you want to take that piece of paper and do something in the cloud with it. But we do that with our banking information, we do it with the way we stream music, so our job is to also educate ourselves and then pass that on to our patients. And a number of the speakers kind of highlighted that. And again, for me, that's part of the job of my office, is to start having more conversations that engage the public. To know that you're not just doing this willy-nilly. You guys heard, we didn't even get to unpack, like, what is FHIR, what HL7, how do those guide? You might hear about some of that. But providers are not, and should not be building digital systems in a silo that don't operate on. There are federal guidelines. So if we're operating under those federal guidelines, there's a first level of safety that you can communicate to your clients. This isn't just, I went out and bought a computer and now I'm emailing insecurely your information to folks. So I think just giving some general education about, from practices and hospitals, that we abide by these standards without having to go into what they all mean, is important. Good question. You set up something I was going to share with everyone. I wouldn't say there is a one-stop shop, but there's CMS.gov with all their standards. You heard from ONC, there's CISA, but on the OHIT website, to help understand kind of what are the standards that are out there now, what's all this language. If you go to OHIT's website, we do have a glossary of terms that you can share. I highly recommend. I was going to say print, but I don't highly recommend printing out, but disseminating that link to your staff so that everyone's aware of what are the, we're supposed to be abiding by a standard right now. What does that mean? Or when you hear, is your system FHIR compliant, that you know that that's FHIR, not FIRE, and that you understand what that means. So again, there's a glossary of terms and then some of our most current standards, and we keep updating that on ohit.usvi.com. Hold on.
I was asking whether you were planning on doing any continual summits on the U.S. Virgin Islands that are exclusively geared towards the practicing providers and physicians, and bringing some of this information to the forefront as a whole, so that everybody is aware, knowing what standards, what foundations they need to start laying and putting into place in order to meet the expectations.
So this is right now, once a year. It's a very heavy lift, but individually we meet with providers as needed, and we've talked about looking at smaller Zoom series, because no matter which way we plan something like this, it won't work for every provider, especially our private practices. Some have heavier days, Monday through Wednesday. Today is a half day focused on providers. And then a number of our providers have said, today just happens to be a busy day, so they're joining us online. So it's kind of an evolving organic process. But I do want to give a few more minutes to a few more questions. Or takeaways, actually. And please say your name, State your name.
Hey, good morning, Chris Finch. This is a takeaway, not a question. That first of all, thank you, Michelle, and it's really wonderful. You know, for those of us who are working in the Virgin Islands, in the healthcare field, I mean, most every day is figuring out how to keep the lights on, and so it's really wonderful to be able to have a couple of days to focus on a broader picture. But I greatly appreciate it. And at first, when I saw the agenda, I didn't know why, but I've certainly come to realize your brilliance in this, of the starting with the focus on the social determinants of health in a technology conference, and you know, and Dr. Ford was just wonderfully laid it out. And I'm a social worker by background and by training and by career, so I know all that. But all of us get so tied in to our silos and our own challenges and our own limitations or lack of resources, et cetera, that it's real easy to forget that this only works if we have this broad picture, if we all working together, if we all move outside of our silos. And starting with that, and that theme kept being carried on by presenter after presenter, and then adding the tie-in that the technology only works if the patient understands it and the patient agrees with it and the patient knows how to use it. So I kind of came more with the expectation that it was really going to be everything I don't know about technology, and I still wouldn't understand any of it. But it's been this picture of everyone's focus that there's only one way this works, and it's not the shiny toys. It's put in people's hands. So thank you for that.
Thank you. Thank you. My team knows that this starts out as something that looks like a beautiful mind on very large Post-it pads on walls in the office and in my living room, doing that. Like, how do we make the connections to create that big picture? Give me 1 second, but another takeaway, please.
Hi, I'm Sally Hart from CSG. One of the things that impressed me the most was the CRISP technology. And I really want to dig in on that and see how we could possibly help build a playbook and a model for providers to adopt. Because I think you need just a set of standards, a list, a checklist, a task list. Here's how I get on, here's how I do it, here's what it means, you know, here's where the risks are. But it's all over the place right now, so we got to bring it together and give people a playbook that they could use to adopt that technology.
Yes, thank you for that. So what we're calling it is a roadmap. So that is kind of conversations, so that everyone hears this. Next steps for bringing it all together. The first stop is developing the use cases. What is this going to be used for? What are our primary use cases? Because it's technology unless we don't know if we're using it right unless we know what we're trying to solve for. So that's the next step after this is there is an executive steering committee that involves Department of Health, Human Services, both FQHCs, both hospitals, BIT, my office, and working with PCG. The first real stop on the train is fleshing out our use cases so that first the pilot doesn't commit us to CRISP as our HIE. It's just can we establish some basic interoperability, and so that it builds confidence, because if we keep just talking about this theoretically, we'll just keep talking about it. So it's like getting to play around in a test environment and say, okay, now we're clear on how we develop this roadmap and what problems we're trying to solve. But we do want, if you want to be involved, we want to figure out how, because you're already working with SNAP and Medicaid to integrate those systems, so that's part of the conversation. So, yeah. Mike? Can we get the mic? Right here. Back to Sally. Right here.
So I originally was in the financial world, and to build a network, you got to get people on. So you need your first few adopters.
Exactly.
And you
Yeah.
got to build this side to side. So, but once you get a critical mass,
Yeah.
then everyone wants to join.
Exactly.
So that's where you got to go.
Yeah. All right. Any other takeaways? We've got Mike over here, and then back. I didn't know if you were handing the mic off or if you were. You can make your way to the stage, actually. Boyd, Mark, and Kem, and Damon House, please.
Brian Bacot, one of the local physicians, and Director Francis, thank you very much for putting this together. This is very important for us as providers. You know, we don't have a whole lot of time to absorb this. And I think in the first day when I sat down and looked at the presenters, I was thinking, oh my God, each one of these presentations is a PhD learning process in and of itself. And I'm thinking, oh my God, how am I going to turn back to my local guys and girls and say, you know, you got to learn this, you got to know this. But, you know, if we all start thinking as providers, like what we know now, we assume our expertise started with all these little experiences. And yes, I've been here 15 years and I've sat in this conference and people will tell me, you know, we've done this 3 or 4 times and it never gone anywhere. But those little experiences is what built us and allow us to come here. And Director Francis has assembled the people around us to get us going. So everybody needs to be involved. We can complain, but we turn our complaints hopefully into actions that are movable and sustainable, and keep moving forward and be part of the process, because this is where we're going. So you either get run over or you join it. So we appreciate all that you brought to us. The second year has been phenomenally much better than the first year, which was great. So and I look forward to next year as well. So my takeaway is that it's a lot for us, but it's achievable, and we have to think about these accumulative experiences to get us to where we're going. So we have to design our own vision of where it's going.
Thank you for that. I've been thinking, because as this unfolds, I also again get takeaways, and so many of the presentations, which will be online, I feel like we could just invite people via Zoom. We're just going to watch this again in smaller groups to unpack it, because it's a lot in a few days. So it's trying to find this balance between focusing in a large group setting like this on 2 small things, because you'll never cover everything, but then if you try to cover everything, you go too broad. So, but thank you, and thank you for your participation. Anyone else before we kind of take the conversation down?
Good morning, everyone. Hussein Encarnacion, Commissioner of Health. I think it's just a thank you, for putting it together, for bringing the individuals down. I think it's important for us to all realize that, like Chris Finn said, you can't do one without the other. And you mentioned before that health industries sometimes lag behind in reference to IT, and I think the opposition that is gotten from patients is one reason, and them not fully understanding. But for some reason, health conditions is what closes people off. Cancer is something that is not easily spoken of. So if you put it on a piece of paper, then it makes it real. HIV is something that is not spoken of. If you put it on a piece of paper, it's real. So to take that realness away is going to be very hard. So that's why it's a combination of, and of course, most people trust, nurses are the most trusted, right? Mm-hmm. But most people trust their physicians. And so to get physician buy-in to IT is becoming more and more popular, but it wasn't that popular before. It was even hard to get the physicians to start doing their physician entry into notes in the hospital system. So this is, to me, seeing the physicians here, seeing the providers more involved is something that I think is going to be, we just have to be very persistent and not let them back away. We have to dance with them.
Yes.
So thank you.
Yes, thank you. I'm going to invite a few others to the stage. DigiMed. I'm trying to see who all is here. Chartis. So we're going to just have a little bit of a conversation that they're not necessarily prepared for. I also want to highlight, actually, would you like to come up for Gainwell? I see that most of your team is probably in the back room. I'm looking at you. Are you okay? Yeah, okay, please do. So Gainwell and Script Guide, again, thank you. Script Guide RX as our headline sponsors. Appreciation for your incredible support. And ComHit, if one of you would like to join us on stage. This is like pop quiz time. Could we fit one more chair up here? Media One team. Scott, would you like to join us? If we get another. So I'm going to have you actually just give, let's see, 2 minutes. We've heard from Mr. House quite a bit, but 2 minutes that you can either share on your company, what you're doing, just a real quick, and then I'll have some questions for you, or we will, or Damon, you can share a takeaway. But I wanted folks to have a chance to hear a little bit about some of the people that have been behind the veil or we haven't heard from yet, to just hear a little bit more from you. And then we're going to be able to listen in on a conversation, and then we're going to move on into in our agenda with Community Health IT, which you'll be able to hear a little bit about. So actually, let me start on this end of the room. Scott, if you just want to share who you are, your company, what you do, why providers should reach out to you. This is your opportunity to just kind of let folks know who you are and what you could do for them. Just, yeah, keep going, keep talking. It magically comes
I had a
up.
green light. I knew that was important. I'm Scott Henderson. I'm with ExpandMD. We're a population management services company, which is a mouthful. But basically what we do is we work with the existing programs that Medicare funds, and we do start with Medicare funding and work our way down. Not down, but out from Medicare. Programs like remote monitoring, chronic care management, annual wellness visit support, TCM. We're just now introducing cognitive testing. Because the Medicare has programs which through the CPT codes, they allow outsourcing and they pay fairly well for, and the whole goal is to catch small problems early and keep them from becoming big problems. And Medicare, trust me, would much rather pay you guys, 6, maybe even 7 figures now, to save 7 or 8 figures down the road in preventable hospitalizations and slowing the progression of chronic illnesses and that kind of thing. So when we were building this program, we were trying to find out, these are well-funded programs that have undeniable clinical benefit. Why are they not exploding? These aren't new. They've been around forever. And we identified 3 barriers to adoption, which is the questions and the comments this morning were all around practicality. And the barriers that we see are very simple: cash, risk, and capacity. Cash, because a lot of them take some money to start. risk because if your patients aren't compliant, you're not going to get reimbursed and all the cash you just spent is going to go away. And then even practices that implement these programs a lot of times have trouble because you have limited capacity. Even if you spend the money, even if you've got compliant patients, you still have to get the work done. And somebody earlier, I think it was yesterday, was talking about, like, you know, it's just one more alert. It's just one more action item to do. It doesn't seem like it's much until you understand everything you guys are already dealing with and the overwhelming quantity of work you already have. So the last thing you need is just one more thing to do. So we built a program that attempts to address those barriers by offering all of our things with no money up front. We do what we call contingent invoicing, which means if we can't get the patient to a state of billability from the insurance point of view, we don't charge you for that patient for that month. So we try to absorb the risk as much as possible. And then we have staff to do the work for you in a way that's white-labeled, transparent. We have dedicated people to a given practice so the patients get to know them and trust them. They really just see them as an extension of the client physician's care. To them, to the patient, they're just dealing with somebody on doctor's staff for that. And in doing that, we're hoping...
30 more seconds.
Yes, ma'am. You originally told me 5 minutes. We're working on, we allow practices to deploy this out at, not just deploy it, but to deploy it at scale, where it can have a real benefit and a real meaningful impact on the patient population at large for that. We have a local agent here on the islands, Deborah Bacot. Deborah Barrow. We're working with Dr. Bacot as one of our clients. So we're working very hard to establish a good footprint here and bring the services you guys need.
I am Dr. David Willis with Community Health IT. We make it ComHIT just because that's a mouthful to throw all those words out. But I am a practicing family physician, and I see patients 4 or more days a week, but I also serve as the Chief Medical Information Officer for ComHIT. And for the last 15 years or so, we've been working with small practices, rural practices, behavioral health practices in adopting technology and overcoming the barriers that allow them to adopt those technologies that work as better tools to provide better care. So that could be as simple as broadband access to adopting electronic health records to population tools, and we're even able to get some of our practices involved in clinical research even though they may be a smaller practice. So one of the latest things that we've been able to do is get involved in workforce development, understanding that many of these small practices are challenged. And these are things that we have heard from the people in the Virgin Islands as well. And even some transportation opportunities in trying to get community health workers to be transport for some of these patients and use that captive audience moment to educate them further and enhance their care additionally. So you'll hear more about that in the next presentation that we get to give. But the reason that we came here to the U.S. Virgin Islands was when Director Gary Smith commissioned us to do the environmental scan in 2022 and 2023. And you'll hear a little bit more about that in our next presentation, but gave us the opportunity to learn about the readiness that many of the physicians and the providers of the Medicaid program, as well as the other organizations that support Medicare care, and how ready they are for making these adoptions and how interested they were and the things that they thought were barriers. And all of the things that you all are saying were resonating in that report. And so it's been exciting to see the progress made. And I think most of all, the takeaway I'd have is the momentum continues. And that, I think, is what is most paramount in this kind of project, having been through HIE development in my own community in the past. So excited to be here.
Thank you.
Good morning. My name's Jeff Jacobs with Gainwell. And first, Director Francis, let me apologize, as I have absolutely no sock game. So
I've been thinking about a fix for next year.
next year,
No worries.
I'm going to step it up next year.
We may have a different giveaway next year.
What a pleasure to be here and to participate in the conference. We appreciate the opportunity to do that. We serve as a partner with DHS and Director Smith in supporting the sort of back-end processing on the Medicaid program, claims processing, and things of that nature and related reporting. One of the things that Director Smith referenced earlier was the PEA, or Provider Enrollment Application, and this kind of gets specifically to a question that was asked of, what's this going to do for us, right? And we're really excited about bringing that technology and solution to the island, and frankly, we're going to have a session in the back of the building later that we'd love to have folks participate in and show you a little bit of that if you'd like. We're also going to be talking through claims, any claims questions or issues related to that. But just to highlight a few things about that application, if you love paper, it's not your favorite application. Paper's got to go, and so that's what that application will do. It has an online wizard that supports application submittal, document upload, take a picture of it, scan it, whatever. We're flexible there. Has business rules to provide the consistency of processing. That also helps with first pass rates. Application comes in once and moves through the process, so you get benefits such as improved processing, improved accuracy of processing, timeliness of processing. Automated screening activities, that's more on the back end, but the benefit there is speed of processing. You can update your license information, maintain demographic information. So we're really excited about bringing that. That is something that should specifically help expedite the process of enrollment. Enrollment's a little bit like taxes, and again, pardon me if enrollment's your favorite thing, but it's something folks want to move through efficiently and quickly, and that's what that technology will do. So we're looking forward to bringing that. Thanks.
Thank you.
Hello, hello. Hola. My name is Mara Echevarria. I am the clinical director at DigiMed. First of all, thank you for having us. We are here because we would like to share outcomes of actually programs that have been established here at USVI. So at DigiMed, we are a healthcare services and consulting company that helps small providers, medical facility, and federally qualified health centers use programs like CCM and RPM to truly engage patients and help those patients take control of their chronic disease. And during a breakout session, I'll be sharing the outcomes of patients here from USVI that I am very happy and excited to report truly took control of their chronic disease against all odds of being in the middle of the Caribbean and all that things. So thank you for having us, and hopefully I'll see you there.
And a special thank you to our friends from Puerto Rico. We're so close, but sometimes there's a divide that I'm happy to see us bridge more and more. So
Thank you.
welcome.
Thank you very much. On behalf of the Southeastern Telehealth Resource Center, I would like to thank Director Francis and her team for an absolutely great job. It's a privilege for us to be here. The Southeastern Telehealth Resource Center is one of 12 HRSA-funded telehealth resource centers in the United States. The Southeastern Telehealth Resource Center covers Alabama, Georgia, Florida, South Carolina, and now Puerto Rico and the Virgin Islands. We are a free resource to serve as a focal point for advancing the use of telehealth to reach underserved populations. We provide free consulting services on everything from program design through to technical assistance. For example, if schools would like to put a telehealth program in place because those kiddos don't have access to a nurse at the school, and the school would like to be able to connect the student to a nurse or a doctor remotely, we can help with that. Rural clinics, federally qualified health centers, community clinics. practices, anyone who wants to provide telehealth, we're here to help. We also do.
Wait, say that again.
For
Y'all who
anyone-
want to know about free resources, and I
Free
want it on the
resources.
record.
That's right. Free, free, free. As Dr. Bacot said, we're like your community, your county extension agent in agriculture. Practices can come to us, and we're here to help.
And if they want guidance, because the world of telehealth, telemedicine is so vast, a lot of our docs are like, I'm a doctor. I didn't go to med school to figure out how to figure this out, but you can help direct.
Absolutely. What do we need in terms of equipment? Do we need a complex cart with peripherals, or would we be fine with just having a tablet? Training staff. Our staff doesn't really know much about telehealth workflow. How do we manage an intake when someone is remote? What about HIPAA and privacy, etiquette, setup, all those things? We're happy to help with. We have online training.
Can we put your cell phone number on this screen?
Absolutely. And we have online training programs, which are all free. So please do reach out, get in touch. We are here to advance the use of telehealth for folks who have adverse social determinants, who need improved access, and we are really focused on improving the outcomes.
And on their website, by region, the USVI is on there, so you can access the resources by clicking on the USVI tab.
Absolutely. So thank you very much.
Thank you. And Boyd's been part of the planning journey as well, which he did not say, but he's been, many of you met Lloyd last year, and we miss him, so hello, Lloyd.
That's right, it's the Lloyd and Boyd Show at the Southeastern Telehealth Resource Center.
Thank you.
So good morning, good afternoon, good evening. My name is Damon House, although today I am playing the role of Luigi. Clearly I am much more casual today. I'm heading out to the airport. I'd like to thank Director Francis, although it's not really gratitude, it's more fear. Because when she calls, I snap to attention and I say, yes, ma'am. How may I serve, ma'am? What can I do? We talked about how I had been at Microsoft and I have since left and doing consulting, and that's fine, but I don't want to take this as a commercial for that. What I would love to say is that this week I've met some really interesting people, and I've heard some really, really good conversations. And it was yesterday afternoon, a bunch of us were sitting and then we were having lunch, and we just all kind of stopped and we looked at each other and we said, oh my goodness, wait, we have the idea for global domination. We should do that thing. And so we are, some of us who are laughing, and some of us who are free, we've come up with some ideas. And these are the types of conferences and the types of conversations where we can have those opportunities. If we're all in our own offices, in our own regions, in our own country, mainland, islands, etc., and we don't get together for opportunities like this, then we don't realize how this one service plus that one service plus this one equals 10 services. It's the synergy of coming together. And that's the power of what Director Francis has been doing. And now I'm going to tear up.
I knew, don't do it.
I'm really excited about the prospects of what can come out of something like this. I had conversations with some folks from Puerto Rico yesterday. I want to see how the integration with the University of the Virgin Islands can integrate with the HBCUs up in the United States, in the mainland. But I want to see this momentum continue. And so I charge each and every person in this room, if you feel that momentum, if you feel that energy starting to die down, go back, watch some of the videos, so the Dr. Ford's keynote, and just get re-energized so you can keep running and you can keep going, because our community needs us to be at full speed in order to serve them. So thank you.
Thank you. And Zaynette, Luigi, if you were, or Alexandra, if you'd like to come share for Zaynette, please. Actually, we haven't heard from you, if you're willing. Yeah, you can come. Okay.
I will generously give up.
You'll willingly give up the mic?
Oh.
Yep, you can go ahead and when we get her seated. I'll let you settle in. Kim, if you want to introduce yourself.
Hi, for the guys over there who can't see over here, I'm Kim Tolliver, and I'm with Medical Revenue Cycle Specialist. Thank you so much for bringing revenue cycle to the conversation of health technology. So my team and I, we're boots on the ground with private practices, with health departments, with hospitals, and with technology vendors. What we do is revenue cycle improvement, revenue cycle optimization, new practice startup, making sure that organizations who want to provide healthcare services have the skills and the resources that they need to do that. We also do a lot of education, and we're partnering with Dr. Wanda at UDC in Howard. I also do a lot of national content development and delivery surrounding coding and revenue cycle improvement. Just out of curiosity, is anyone really familiar with revenue cycle management? Okay, well, we're going to talk about it in the session later on today, but it is such a pleasure to be here, and I absolutely love the fact that you all have such great innovative technologies. What I like to do and what I do very well is I translate that technology into actionable operations and workflows within medical practices. And then what we also want to do, I think, Deborah, you mentioned it, like how do we get this into the practice? And, you know, one of the things that I see often with obstacles with adopting technology in the private practices is physicians, they are at the top of their skill in medicine. Technology, no. Business operations and finances, not always. So they are really relying on us to educate them about what are the practicalities. Tell me where I need to click. Tell me how much I'm going to get paid. Tell me what rules that I don't want to break. So again, it's a pleasure to be here. Thank you so much for having me, and I'm really looking forward to talking more about revenue cycle management later.
Thank you. One of the reasons it's important to have you here is, well, I cannot raise my hand and say, well, I could do not even a 2-minute intro on revenue cycle. I've worked in hospital administration, and it's key. It's like one of the wheels on the bus. Or two of them. And so part of the question about affordability, to me, is first are your baseline operations. Are you maximizing what you are bringing in? Is your revenue cycle working? And how do you make some of these improvements and enhancements work for you? But I can't answer that question, so thank you for being here. All right. Alexandra, if you can introduce yourself and Zane, please.
Yeah, good morning, everyone. I'm Alexandra Cellaret. I'm co-owner of Zane Networks. Luigi LeBlanc is the other co-owner and vice president of technology, which many of you probably talk to and know. I actually know Kim, and I will attest to her great work in revenue cycle management. We bring her in on a lot of projects, and she's an expert. I've seen her help practices, you know, kind of transform their billing and just become more profitable. So I will attest to how important, you know, that function is. And I know we work with the Mid-Atlantic Telehealth Resource Center in our area, and it's a great resource for practices looking to implement telehealth. They have a wonderful conference closer to us that we have attended as well. So yeah, Zane Networks, we are a health information technology company. We did a lot of work originally working with practices to implement electronic health records in the age of meaningful use. So we, at that point, we still are vendor agnostic in terms of going in and providing technical assistance. So that's expanded from electronic health records to new, you know, other technologies, telehealth, remote patient monitoring, et cetera. We've also been brought in under larger, like, government projects, district or state projects to provide kind of technical support to practices so they can meet certain federal program guidelines and state guidelines so that they can qualify for incentives like MIPS, PCMH type consulting and things like that. And what we've been doing a lot lately is bring academia, government, and then practices, hospitals together to go after larger projects, federally funded or state funded, to improve the way that organizations use and leverage technology, health technologies. So we've worked with Howard University well, we work with them quite a bit actually. Howard University, University of District of Columbia, under projects like Fit for DC, which was described the other day, and are working on other initiatives like that, where we bring large institutions together and we kind of help on the technical advising side of that as well. And we do some software development. We've gotten more and more into that and are working with some open source tools developed out of the federal government and helping entities like Connecticut Inc. program and New Jersey Inc. program implement those open source tools to better manage at-risk kids in a more affordable way that might meet their budgets better than buying a larger system. So that's generally what Zane Networks does. If you have any questions, I'm sure you can reach out to me, Luigi. But this has been an excellent conference this year. Just hearing some of the amazing work that's being done here on island and just seeing that there's some synergy there as well. So we really just appreciate it. And it's needless to say, it's a beautiful island. So beautiful territory, beautiful part of the United States. So thanks so much. Mm-hmm.
Yes. So I wanted you guys to be able to hear a little bit from them collectively. What I appreciate about Zane, about both you and Luigi, is I worked in hospital and healthcare strategy and expanding service lines, and so I come from a strategy background in business and healthcare, and you guys have that strategic mindset. I know that Damon does too, so I kind of connect automatically where it's like, okay, we can see the puzzle pieces and see where they fit. Just give us an empty floor, give us a second, and we start. So that I appreciate that. So in addition to all of what you shared, I think what you bring as an asset to anyone that talks to you guys from a state level on down to a practice level is that ability to help put the puzzle pieces together and to give guidance in that way. So I've appreciated and benefited from that and from all of you. So thank you. You can make your way off the stage now because we do have a video. I want to keep us on time, so we won't ask any more questions here, but please make sure to connect with folks. We will share a conversation with you. I'd ask Community Health IT to be ready to, you could stay on stage if you want, unless you have things you need to bring up. And we can get the video up. But Community Health IT, as you heard, has been supporting the Virgin Islands for about the last 2 years. CMS commissioned when there was still, it was under high-tech funding. They commissioned, as we looked at the first step, there are steps to establishing an HIE. One of them required by CMS is understanding the landscape that you're in, your readiness, where your hospitals, your FQHCs, your practices are at in terms of their technology, in terms of their ability and readiness to adopt technology, to have an understanding of the landscape that you're trying to build something in. So they came in, they're very much a hands-on team, very personal, and have built relationships with the provider community here. Private practice as well as the hospitals, the FQHCs. So they are a trusted resource to share what came out of and continues to be illuminated through the environmental scan. So when the video is over, Kendra, if you're not presenting, I would like you to still introduce yourself before you guys jump in. But we're going to share this video again. It's a conversation. So Dr. Ellis is part of this conversation. Dr. Ellis, morning, our territorial epidemiologist in Department of Health. I encourage you to also, you'll gain a lot from this session. You'll also gain a lot from making sure you check out, if you missed Dr. Ellis's session and their panel where she shared from the EPI report, there's so much to be gleaned and understood. So I think if you take even 2 of these documents in tandem, you'll have a much better understanding of kind of where we're at from an EPI perspective and a technology perspective. So are we ready to roll video? Okay, thank you.
Prevent others from getting sick. So an example of something that we recently dealt here with is Zika. And when Zika was coming into the territory, we needed to make sure all the providers knew what it was, what are the signs and symptoms, how do you treat it, how do you prevent it. And so we did provide a lot of mosquito control, free mosquito control for pregnant women in and around their homes.
How successful was that? Did you guys have a good outcome with your work on Zika?
Yeah, it was really successful. Obviously, if you were here during that time and pregnant, it was very scary because you had to make sure you didn't get bit by a mosquito that could transmit the virus, which was almost impossible, but wearing long pants, long sleeve shirts.
Did you give people, or what did you recommend that they do?
Yeah, long sleeves, long pants. Even in this weather, you could wear loose fitting long sleeves and long pants, as well as mosquito repellent on your skin. We actually did mosquito control in and around a 200-meter radius around pregnant women's homes, so that there were just less mosquitoes in and around their home. Provided bed nets, anything possible to prevent it. We did end up having 273 women get Zika while they were pregnant. And so then we also provided services to all those children and have been following them up to year 5 to ensure that they had occupational therapy and speech therapy and anything that they needed to make sure that they had the most successful outcomes.
So how does that work with the public health department being able to connect them back to all of the therapists?
So if the specialty was not within the Department of Health, like a pediatric neurologist, we actually had providers come into the territory to see all the children through what we called Zika Health Brigades. And all the specialists would come For a week straight, we'd have the children come in and move from provider to provider. In about a 2-hour visit, they'd see everyone twice a year. And
Okay.
so we do have limited services. It's a small territory. We don't have a full-time pediatric neurologist. So we had to connect with providers stateside, and they would come here to provide some
Is there any
other
type of
services.
telehealth follow-up for them in between those in-person visits?
There is, and there is actually now a pediatric neurologist that comes regularly into the territory as well to follow up with those children as well as other children that might need.
Sounds like a great outcome from a bad situation, right?
Yes.
Okay.
Definitely.
Well, thank you so much
Yeah.
for giving us that information. I really appreciate
definitely.
it. It's so nice to meet you.
You too. Thank you.
Thank you. Okay, thank you, Dr. Ellis, for that wonderful information. And I'm so excited to think about how the technologies and the tools that we've talked about this week can make your job so much easier or so much more scalable to reach things, to address these issues more readily. If we can have our slides come up. This is going to be an audience participation presentation. So one of the things that we're going to dive a little bit into was the focus groups, which is the conversations that we had after we did the quantitative surveys. So we're going to offer you the opportunity to participate in some of the same questions that we asked those participants roughly 8 months ago. So if you are on your laptop, we'll give you a website and a number to code in, or if you just have your smartphone, you'll be able to scan the QR code. This is simple technology to use, but you will also see all the results of the questions that we asked. So next slide. This is just the abstract of what the presentation is about. So if you look at it afterwards, you'll get a good introduction. Next slide, please. Okay, so Slido is the technology that we're going to use for this, and this is what your screen will look like on the phone. In the next slide, which when we get there in a minute, you have the opportunity to answer poll questions anytime during the presentation. You can also include questions, and our other partner here, Kevin Salazar over here, is going to be monitoring those. All responses are anonymous unless you choose not to make them anonymous, and you'll be given a prompt to say, put in your name and email. Or you can click on the little person icon up there and include that information, and all subsequent answers will have your name and email attached to the response. So let's test this out. If we can have the next slide, please. So use your QR code, and I'm going to do the same. If you are using a laptop or whatnot, you can use slido.com and then 3315376. And the question that we want to ask the audience is, did you know our esteemed director, Mr. Gary Smith, is a talented karaoke singer? He is so good, in fact, that his talent landed him an audition with the popular TV show The Voice. So is this not likely? I would definitely believe that, or I would like to know more. Make sure you click send to include, and while we can't show it up here on the screen because of the streaming technology, on your device you are going to see the answer from the audience poll. And I see that we've actually had, looks like 16 people respond. And I guess we'll have to find out from him later, but the majority, 63% of you, think that is not likely at all. You must have heard him sing.
They must have not, can you hear me? They must have not heard him sing.
True, he can sing very, very well. All right, next slide, please. So Kendra, I'll let you introduce yourself.
I'm Kendra Seiler, just a PhD, not an MD like Dr. Willis, but I'm the CEO of ComHint. So as Michelle mentioned earlier, we're a 501c6. We're located at Kennedy Space Center in Florida. Anytime you want to come visit, just let me know, and we'll make sure that you can come for a lunch or come to the visitor complex. The last 20 plus years, closer to 25 years, I've been working in technologies and workforce. I started out at the University of Florida. I got my PhD in microbiology and immunology, And then I went on to the McKnight Brain Institute in the Department of Neuroscience, where I did fetal alcohol syndrome research. So research that worked directly with communities, required a lot of community engagement. I did do benchtop research with that, but still that particular type of issue that children have to grow up with, and then may end up in the incarcerated because of. I really felt a closeness working with that. At the time, I was also on our Health Planning Council, which served a big region. It did all the health planning, including technology planning, for all of the providers in the region in North Central Florida. And it managed a lot of nonprofits, one of those being something called a Rural Health Network. So it's a federally designated network. And they lost their director, and because I liked it so much, tongue in cheek, I think the person said, "Do you want to take this?" And I said, "Oh no, I can't do that. I have millions of dollars of NIH grants right now. I can't do that." And I woke up the next morning and I was like, I want to go do that. So I transferred my NIH grants. I left that and met up with Dr. Willis, and we ended up. He started a health information exchange in his town, Ocala. And I said, can we expand this? And we expanded that throughout the region, and it became the first rurally based health information exchange in the nation. So in 2011, we established ComHIT. By 2013, Dr. Willis and myself, we both got the Office of the National Coordinator Award for helping all the rural hospitals go from paper to EHRs and beyond that with health information exchange nationwide. We've both been past advisors for White House Rural Council during Obama administration, and also the Office of American Innovation during the Trump administration. Currently, I'm the lead of Wave 1, which is the Health and Human Services program, and it's a federally awarded program for coming out with cybersecurity best practices and recommendations from HHS for providers and health organizations of all sizes. And these are actually in federal law right now. And that's it for me. So let Dr. Willis take over so he can introduce himself as well.
So you've already heard a little bit about me, but the thing that I would say that I'm most proud of is my practice. I continue to practice as a family physician day in and day out. I've had the opportunity through my career to own my own practice, to be a small practice entrepreneur, as well as a federally qualified health center chief medical officer, where we had 7 sites across our county involving dental and behavioral health and telehealth. And then I was also a chief medical information officer for 421-bed community hospital. So through my career, I have seen lots of those different roles and opportunities, and try to use those experiences as we work with other practices to try and adopt health information technology. So we can go to the next slide. So you've heard a lot about what ComHIT is already this morning because of these 2 introductions, but a couple of other features to comment on. We are based at the Kennedy Space Center, as Kendra mentioned, and that we are working on issues of cybersecurity and workforce development, as well as IT adoption for a lot of these practices. And we're constantly seeking out new grants, opportunities for low-cost or free resources for practices to engage with. So next slide. So today we're going to mention the environmental scan in case you haven't seen it before, and then give you the link to see that and download it and preview it at your leisure. Some of it will put you to sleep, but much of it won't. We're also going to look at some of the technology and workforce issues that came out of that study, and then learn about some low-cost or free resources available to practices that they could utilize that are available now, that you could perhaps participate in to solve some of these issues or overcome some of these barriers. Next slide. So here is a QR code that will link you to the environmental scan. It's over a 300-page report that involves the quantitative surveys that we did of USVI Medicaid providers, as well as IT professionals and health-related executives. Then there's information in there about the qualitative findings, where we held focus groups with both leadership and IT professionals, and we're going to go into that a little bit more in this presentation. And then we also worked on doing a minimal acceptable risk standards for exchange evaluation, kind of a snapshot of where the Medicaid office was at the time and in preparation for adopting some of these new technologies. Next slide. So the whole reason for the snapshot, as we mentioned, is to understand where we are. So Kendra, where did we find out we were?
So this slide is really to point out what Dr. Ford brought up on the first day. She was talking about knowledge is power. And what we're equating the knowledge to here is visibility is power. So instead of us telling everybody at USVI within the health system and within the government what they need to do with health information exchange, this environmental scan went and found, what do you feel that we need to do? What are your burning needs? What are your burning barriers? And cybersecurity was one of those. So, really, like some of the pieces that we're going to be talking about today, because Dr. Willis did bring some of the provider findings at last year's Digital Health Summit, is going to be about your digital security that wrap around the health information exchange and your telehealth, any type of technology that you're going to need to do, your workforce needs, and what do you need to do to make sure you're reducing any risk that you may have because of the technology complexity that you're going to be moving into as the future progresses. So this scan is giving you visibility. That visibility is giving you knowledge and then power to reduce your risk and improve your cybersecurity and workforce. So I don't really know what happened to that font there at the top, but this is something that I wanted to point out before we get into the environmental scan. Our reality is actually a little bit scary, but this is the reality, unfortunately. And what I did is I put some stats that really speak to small and medium-sized businesses, because the island is mostly going to be small and medium-sized businesses. And even though you have density, especially here in St. Thomas, it's still remote. It's still very similar to what like a rural area would experience stateside as well, an underserved area. And definitely this is also an underserved area. So the first thing I want to point out is that cyber criminals, they have a we'll take anything we can get philosophy. So if you think, oh, they're just hitting the big companies, they're just hitting the Targets, the Ubers, like all these other companies that are outside of the Virgin Islands, that's not what's going on. If you have a vulnerable IP address, or if you have vulnerabilities, or if you have people that are clicking on phishing emails or phishing text messages, they're going to be hitting this because they're not looking at where to go. It's bots that they're controlling that are just going to every IP address that they can looking for those vulnerabilities. So according to Verizon, even very small businesses that are going to have 10 or fewer employees, they need to be paying attention to cybersecurity. You may not have the same amount of money that the larger businesses do, but there's things that you can do at your business that are low and no cost, and we're going to show you today how we can help you with that to where you can protect yourself and your business. The second bullet, data breaches happen to 83% of companies. So there's a lot of small and medium-sized businesses within that percentage there. That means over 8 out of 10 businesses have a data breach. So with healthcare, because that's the #1 hit business sector, you have to be protecting yourself, especially with the health information exchange and other technologies coming. 88% of these data breaches are caused by employee error. So this is all about training your workforce, training the people that are on your staff, whether they're technical or they're clinical or they're administrative. They have to have a culture of cybersecurity and know what they need to be doing to protect the business. 30% of data breach victims experience identity theft, and then there's 70 days is the average mean time to contain a breach. So within the 70 days that this is going on, your business is losing money. You may not be hooked up to your technical devices for your patients or for your business. And here's the worst of all. 60% of small and medium-sized businesses close down within 6 months of discovering a data breach. Closed down, permanently closed. Within 1 year, that amount goes up to 70%. So if you look around the room and you see other people in the room, that means 7 out of your 10 businesses, if they were hit by a cyber attack, it would close down. So you can go to the next slide. So we're going to go over, you can go to the next slide. We're going to go over the eScan findings that relate to cybersecurity and tech workforce development right now. Just briefly about the survey. We did survey 3 different groups, one being the providers on the island for the USVI Medicaid and some others that didn't take Medicaid, but there are 620 Medicaid providers that were surveyed and completed the survey. 11 leadership organizations completed the survey, so that's the hospitals, that's DOH, that's different larger groups that work with the health-related organizations here. And then 26 of your IT professional organizations that work with healthcare. And the survey response rates were 56% for the providers, so very high, 50% of the IT professionals, and then 90% of the leadership. We only had one group that didn't do it, okay? So in terms of technologically, where are your IT professionals right now in this? So because you get hit by hurricanes all the time, you have different disasters that happen here that your IT groups need to take care of just because it's a remote island area in the Caribbean. So one of these strengths that they have is account management and backing up your data. They know how to do that. You can see from these stats here, I'm not going to go through every single one of them, but these are saying that the vast majority of your IT professionals feel that account management and data backup kind of policies and procedures that you need to have in place, that they're in place for your health-related organizations. You can go to the next. And the same goes for network and infrastructure security. Your IT people know how to take care of these things. You can see these high numbers here. You have basic user account configuration and other things. Your important data, again, backed up in case of loss of access or loss of data. So these 2 items, kind of like larger items with kind of the smaller points underneath, your IT personnel are excelling in these. You can go to the next slide. So now let's get to your needs. So almost 80% of your health organizations are not following a federally approved cybersecurity framework or are unsure if they are. If you're unsure, if you're following a federal framework for cybersecurity, you're probably not following it because somebody knows that you're going to be doing that. Now the businesses stateside, a lot of them aren't following this either, especially the smaller and medium-sized businesses. But as you saw from those statistics earlier, and there was a huge increase in cybersecurity attacks that went up, aligned with the COVID pandemic, that have not gone back down, they just keep going up. You really need to start thinking about this. 100% of the healthcare providers and the IT professionals, everyone, not using an information sharing and analysis center. Despite your strengths, most of the IT respondents felt that they don't have access to adequate resources, people, funding, and tools. And then the most cited tech workforce obstacle was technical skills of staff, data security, and then computer technical support. Of course, cost is always an issue, so I just put cost last. Cost was still like the top. So despite needing staff and structured professional training at a lower cost, there are less than 10% of your businesses using apprenticeship programs. This is like the best way, even though it's a long-term way to attract talent, to train talent, to retain talent. Only 10% are using any apprenticeship program. So we can go to the next slide. So when we looked at the credentials of your IT professionals and all of the organizations across the island, there was only one respondent that had an IT-related bachelor's degree, and 1 respondent that had CompTIA A+ and Network Plus, which are kind of the gold standards of IT administration type certifications and credentials. 67% of the respondents, they reported that their workforce needs these credentials. So I just have the list here. There are other ones that were listed as well, but I didn't want to put them on the slide. But these are kind of the main ones. These CompTIA ones. CompTIA is an organization that does training and certifications. Like I said, it's the industry gold standard. The fourth bullet down, Health Information Technology Certified Manager for physician practices. That is for practice administrators, so they can make sure that they are liaisons with all of your vendors and all of your IT groups that work with you, the subcontractors. You can go to the next slide. And what keeps your IT pros up at night? So these are the 3 things. 80% answered email and phishing attacks. Their social engineering is keeping them up. 73% ransomware. So again, social engineering typically leads to ransomware, and then that's the one that shuts everything down. You either have to pay the ransom and pray that you get your data back, or you get your computer turned back on, or your network turned back on, or it doesn't happen. Think of it as like if there were a child stolen and they said, here, I'll give you the ransom, but you're not feeling really sure that if you pay the ransom, you're going to get your child back. So this is the same type of thing, but with your business and your patient's information. And then 47% are concerned about insider accidental or intentional data loss. I bet if they saw the IBM study that showed that most of it is human error, that 40% probably would have increased as well. So you can go to the next slide. So what should keep your health executives up at night? So your leadership at your health organizations. 57% of the IT respondents, so this is not the health executives that said this, these are your IT subcontractors. They said either the entity that they're subcontracting for, working for, does not have a HIPAA security officer. All of you had a HIPAA privacy officer, but a HIPAA security officer is also required, a designation of that. It may be the same person, but you still have to have that person designated by law. But 50% of your IT personnel don't know who the security officer is. And then 29% of the respondents, they were the officers, and then the remaining 14% knew who the officer was. So they're doing pretty well. So down here at the bottom in the blue, it says what this HIPAA security officer is responsible for, this required HIPAA security officer. They're responsible for the ongoing management of information security policies, procedures, and technical systems to maintain your organization. So the first thing that I need everybody to do that's free is find who is that person going to be? Who is that HIPAA security officer at your site, at your health organization, if you don't already have one? All right, go to the next slide. So what else should be keeping them up at night? I underlined the important pieces here. 50% believed that their organization has established procedures for managing cyber attacks, especially malware, which is what leads to the ransoms and phishing. But there's another half of you that don't believe that that's happened. So 1 out of 2 of you. So if you don't feel that this is done, that these policies and procedures are in place, you need to get them in place as quickly as possible. Only 25% feel that their staff is trained on phishing, on social engineering. So it'd be really important to go back and pay attention to that first. How is your staff being trained on responding to social engineering? When somebody says, help, here's this invoice, or, different things. Is your staff trained not to click on those things and not to answer? And sometimes they can be very sophisticated and tricky. 8%, only 8% of you, so less than 1 out of 10, is conducting phishing campaigns with your staff. 20% of you have established cybersecurity policies, so again, get those cybersecurity policies in place. 30% has an established data classification policy, and only 35% are using multi-factor authentication. You know that really annoying thing when you put your password in and then it says, okay, we're going to send you a text, and then you have to put in this code, and you're like, why am I doing this? You're doing that so people can't just take your password or hack in and get in that way. So really, that's like one of the main things that HHS is pushing for people to start using multi-factor authentication. It may not be your cell phone, it may be another way, it may be biometric, it may be your email or something like that, but at least don't use only one way to get into whatever it is that you need to get into, and don't be sharing your password with multiple people. Everybody needs to have their own password and their own access to get into things. All right, you can go to the next slide. And I will turn it back over to David so he can go over some of the qualitative findings that we found during the environmental scan.
Okay, so the next slide, please. So when we sat down with the leadership or providers or IT professionals, we dove into some of these topics that came out in the quantitative data. And we asked, these were the 5 main themes that we asked, and we're going to actually ask you some of the same. So what are the benefits that the HIE can provide to improve our patient outcomes? What kind of implementation support needs do we have? Your organization, like, what are you going to improve? Like, what are those use cases? And we had some discussion about those. And then what barriers do they have, and how are they going to convince their hesitant peers to participate in the HIE? Because obviously, those of you that are showing up here are motivated, you're interested, you want to know, but what about everyone else who's not expressing any interest? How do we get them on board? Because as we have heard today, it's going to take a village. And if we get a bunch of primary care doctors to do it, and then they send information to specialists, and the specialists are not participating, well, now we have a gap in that use case. There's no value to the information because the people that need to use it aren't going to have it. So we want to get as many people involved and participating as possible. The most cited barrier in the focus groups was cost, followed by training and skills of the tech workforce. So if you'll go to the next slide, please. If you have your devices out and still on that webpage, you probably will have the next question, and they are some of the same issues there, and you can select more than one. And then make sure you do hit send, and then you'll begin to see the responses as they all come in. Only 2 of you have participated so far, and I'm one of them. So I'll ask this question as you are supporting that. Do any of these topics resonate with you or your organization? We certainly heard of, multiple examples from the providers, from the organizations, from the IT leadership. It seems like IT workforce training is definitely bubbling to the top. Anybody have any comment or question over there?
Participation, oh wow, that was loud. Participation with an HIE allows provider practices to bill for transitional care management. So like when you are notified that your patient has been hospitalized, and then after their discharge, you can bill CPT codes for transitional care management when you connect with them within 7 to 14 days post-discharge. So I think billing and revenue cycle might also be another opportunity there.
Absolutely. It's an excellent point, and one that came up earlier in the conference this week, where the question was like, what is the business case for the health information exchange? And that certainly is one. We've heard about patient monitoring. We've heard about the chronic care management model, and that's extra revenue that a practice can entertain. There's also efficiencies that are sometimes gained where there may be services that you're providing in your office or in your organization that you don't actually bill for because it's too complicated to actually document what you need to get paid. But automated processes or enhanced processes of documentation that could be available if you utilize your electronic health record to its fullest extent, then you would actually be able to bill for services that you're already providing. And then you aren't actually doing something new, you're actually getting paid for what you already do. And so there are opportunities to create a business case quickly that provides you additional revenue to get your staff trained or to add that one extra person that can then create more revenue. Again, many practices are beginning to learn that it's not just what the physician or the nurse practitioner or the PA bills. There are other opportunities that other staff can actually generate revenue for your practice so that everyone can have a better paycheck, so that everyone can be involved in actually getting more patients seen and more care provided and a higher level of care provided. There's that notion that we've heard about for many years is that everyone should be working to the highest level of their license. So maybe it's not getting me, the physician, to do all of the tech work, but getting someone else in my practice to do the tech work that makes me work better and make me work efficiently. I went through an exercise when I was going through residency of creating a database of what is actually going to be my most effective way of enhancing the revenue of the practice. Is it going to be reducing overhead? Is it going to be seeing extra patients? Is it going to be adding services? And by and large, the answer was one more patient a day. If you actually saw one more patient a day, now this was 25 years ago before some of these other resources were available, but I know we're feeling frustrated with that rabbit wheel and the hamster wheel of like, let's just see more people, let's see more people. But the idea is seeing more people effectively and being able to provide the kind of care that we want and share the information that we need so that patients can get the care that they need when they need it and where they need it most. So we can go to the next slide. I won't read all of these to you, but these were 3 of the comments that came out of the focus group related to those questions, and they resonate with the conversation that we've been having this week about IT staff. We have excellent staff, but we do need more staff, and we need more technically capable staff. So if we can go to the next slide, I have one more question for you, and that is, what specific staff resources does your organization need to successfully participate? Is it going to be more clinically health information technology trained staff? Is it just, I need more staff in general? Or clinical informatics staff? We heard about some of the great opportunities this week about how we can get more clinically trained informatics staff, or just, we need IT staff, just IT people. So which one rises to the top? So we are getting some responses from the audience, and it looks like 50% of you are saying more staff in general, with a gaining clinical informatics staff as number 2. So even the audience today is resonating with the things that people said in the focus group then, that now it's a tie actually. Oh, no, it's shifting, continues to shift. People are continuing to participate. But we do need to train our staff on how to utilize this new technology. So there is that upfront involvement, but then their return on investment is not just financial, but it's for your patient's sake and for your staff's sake. We learned about some great opportunities this week, and we'll hear about some more in a few moments, to up-train your staff with both the knowledge to perform the duties that they perform now more successfully and more safely in light of cybersecurity and technology utilization, but then also skilled at new services that could be provided in your practice or in your organization, or to provide a new service line of care that maybe you didn't even provide before. Right. So more clinically trained informatics staff rated #1 with more staff coming in just behind that. So next slide, please. And again, there was the comment about getting that pipeline of education going within the territory so that we don't always have to find someone out of the area to fulfill the needs that we have in information technology. And there are more quotes involved in the report that you can find from people that participated before, and we thank you for your participation. We'll have one more question at the end of the presentation. And I think next slide, we'll move it on to Kendra, and we'll go to the slide after this.
All right. So the first resource I want to share with you that is absolutely free is called the Health Industry Cybersecurity Practices. They call it HICCUP unofficially. So if you want to be in the know, then you need to say HICCUP. This started back in 2017. HHS wanted to recommend cybersecurity practices for healthcare organizations of all sizes. This was mandated in the Cybersecurity Act of 2015 under Obama administration. And the only business sector called out in the Cybersecurity Act to protect national security was the health sector. And they made sure that they were mandating a public-private kind of partnership to where these practices would be put in place and then put into law. They're not mandated now. Now they're just recommendations. But just like if you look at the tea leaves, it's going towards to where things are going to be mandated. So the faster that we can get underserved groups, USVI, rural groups, following this, the easier time that they're going to have once they become mandated. So this is really broken up into 3 documents. There's the main document that just kind of, that's what your health executives really need to read. It's going to review just your cybersecurity threats, vulnerabilities, trends. Technical volume 1 is what I really want to point out for your IT folks. And that is going to discuss 10 cybersecurity practices in a very technical way. For small health organizations, but people who are doing your IT for you, that it's not going to be hard to them. It will be something that they'll say, oh yeah, we're doing this, or we need to do this, but it's all laid out there for them. Technical volume 2, that's designed more for large health organizations and large health systems. So there may be some things in there that some of you may want to go to because you're more advanced, but typically, the clients that we work with, they're working with technical volume 1. You can go to the next slide. We just recently released the 2nd edition. That was announced at HIMSS, so that's like the big HIT society meeting that they have once a year. There's some updates to the main document, a few things added in the technical volumes. Something I really want to point out is the cyber insurance that's in there, because a lot of people, they either don't have cyber insurance or it's expensive, or they don't know where to start, but this gives you a place at least to start. And then I just have the practices listed that are covered in the technical volume. If you want to get to this document or you want to send this to your practice administrator, your IT people, your vendors, I have the QR code right up there. It will take everyone to the HHS website where they can find this particular document. And you can go to the next slide. So after we put this document into place, doing what the Cybersecurity Act of 2015 said, the next thing to do was to start getting into public law something that was going to be protective of health organizations. So back in January of 2021, public law went into place 116.321. You don't need to remember the numbers. But what that does is it requires OCR to, if you have a data breach, to essentially look favorably on you if you are doing these cybersecurity practices and you're documenting them. So the main piece is document, 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 the same way as it is for your billing and coding to get paid, the same way it is for this cybersecurity. But the way, I'm going to show you how you can document that here in a moment. The first piece, though, would be to get that HICCUP publication and make sure that everybody is kind of seeing that at your practice. So, and we can go to the next slide. All right, so based on the environmental scan, where we heard a lot of people saying we really need to train the tech workforce, our staff isn't trained, we don't have these policies in place. The way that you're going to work towards this, documenting this, is growing and sharpening your on-island technical talent. That is going to be your strength. Because I know that people come off island all the time and they do things, but you need to have people on island here. It's also going to help with your economic development to have skilled workers on island. It's going to make it a lot easier for companies to either expand here, move here. So it's going to mean a lot for your economy to make sure that you have that skilled workforce, as well as for your health organization. In terms of like what you can do immediately, as I mentioned earlier in this presentation, identify and train your HIPAA security officer. We can help with that. Not with the identification, but certainly we can help with the training. The second is to make sure that all your IT staff and your clinical staff and your admin staff, there's like a 1.5 hour training that HHS has on that 405D website. So the same QR code is going to take you to this training called Knowledge on Demand. I'm going to show it a little bit of it here to you in a moment. After you get past that immediate need, go on to the intermediate needs. That's going to be upskilling and cross-training some of your existing employees. It may not be full-time. It's probably not going to be full-time because your employees are stretched. But if you can start little by little, getting them into like different trainings, whether it's 1 or 2 hours a week that you can do this, then you should start now, especially with the HIE coming into place. Also, your IT subcontractors, they also need training and certifications as well. So you want to get your IT contractors to where they have a certain standard, to where it's easy for them to help you and for you to know that they can help you. So now the longer term talent development, going back to only 10% of the health organizations are using apprenticeship programs. The way to get better talent and to have quality talent, you want longer term talent development, which would be your apprenticeship programs. So for the apprenticeship that we're going to show you today, that we just got it approved and registered with Virgin Islands Department of Labor yesterday, that particular one is going to help you with your security risk assessments, your policy development and compliance, and then also monitoring those cybersecurity threats in real time, at least a little bit every day. So I do have 3 logos down here at the bottom, U.S. Virgin Islands Department of Labor. As I mentioned, they just registered our apprenticeship program. They also have funds where they can assist with money for trainings, money for certifications, and in some cases, many cases, money for wages, especially for new hires. ICF is a company that is contracted to work with VIDOL to really get their apprenticeship programs running here in the islands. And TechQuest Apprenticeship, or TQA, that is one of the Department of Labor grants that we are working on right now. It's a $12 million grant, and we have money where we can pay for at least the training, certifications, and exams for apprenticeship programs, as well as getting the apprenticeships program started at individual organizations here in the Virgin Islands. All right, you can go to the next slide. All right, quickly, the Knowledge on Demand. There are 5 different videos. They are 15 to 20 minutes each, and then those are kind of the 5 topics that they cover. We used to call social engineering email phishing, but now we call it social engineering because it's that more sophisticated, and basically it goes to all sorts of different ways. It may be a phone call that somebody does that's the beginning of your cybersecurity attack. Go to the next slide. If you want to do this training, we do have it on our learning management system, and it's free. And these are the 5 steps to do it. You can contact Kevin Salzer. He's actually sitting right there on the end. He's our Chief Technology Officer. He'll enroll all of your employees in the training. They'll receive a link to the training from him. They can just take these little by little. So they could just do, a 15, 20-minute video and read a little bit and then do another one the next week. They don't have to do it all in one sitting. Then we're going to have a quiz at the end. We're getting a badge made by Department of Health and Human Services that says that you completed the training. And then we'll be sending surveys out again just to provide feedback to HHS if there's things that they can do to improve the training. And certainly we make sure that you're acknowledged at HHS that you're assisting with improving that training. Go to the next slide. This is a certification that really your HIPAA security officers, your practice administrators need. Currently, we're training 13 practice administrators across the Virgin Islands with this particular training. And we had some that were here that I saw earlier in the week that are doing this training as well. And those are the 4 domains that it hits down there at the bottom: general systems environment, project and change management, aspects of patient-centered care, and privacy and security. So, that person can certainly be the point person for several things and learn how to do that. This particular training is only 9 hours to get through, but then you need to study hard because it's going to be a proctored exam, and then you get a credential that you can put at the end of your name after that. And next slide. And get in touch with us about that. We can help you with that. We also have built out CompTIA A+, Network Plus, and Security Plus trainings. Those were built for us by the former leader of the National Initiative for Cybersecurity Education. And the way that we have these set up is that if people are even with a high school equivalent or not with that, there is a way that they can still do the training and get to the end. We have not put it in Spanish yet. It's only in English. But other than that, again, it's asynchronous online. They would be in a learning management system, so they could do it when they had time to go through. Next slide. We also have the Population Health ISAC. Anybody recognize that person up there? It's our own Dr. Bacot. And this is what gives you the visibility to reduce your risk. What we did, this Population Health Information Sharing and Analysis Center, ISAC, is recommended by HHS as well. It's in the HICcup document, but what we did is we made an instance for the Virgin Islands. But we have sensitive, real-time cybersecurity intel threat tools, but the thing is you need somebody that's going to know how to use those particular tools. Both of the hospitals are signed up for those. Both of the hospitals are also signed up for the apprenticeship programs. And we talked to VINGN, who's interested, Quantum Technologies, who's interested as well here. And if anyone else is interested, let me know. But certainly we want to get everybody onto these tools. And this is free. The tools are free. You do have to sign an agreement with us to get on the tools because we don't want just anybody getting on the tools. We don't need cyber criminals looking at our sensitive intel tools. With the apprenticeship, they do learn how to use these tools as well. You can go to the next slide. This is just a little bit about an apprenticeship program. It's not an internship. An internship is something where somebody kind of comes to passively learn like what to do, learn skills for themselves to use later on. This internship or the apprenticeship is where people train to do the skill, to do the task for you at your business. You're training them to fit into your business. So there's 2 pieces to it. There's the kind of classroom training, which is online for us, but then there's also the 2,000-hour training with certain competencies that they need to hit within the organization. And what we do with that is just make sure that it's structured, but it's still flexible enough to fit what your organizational needs are. So you can go to the next slide. One thing I did want to point out with the apprenticeships, it can be your incumbent workers or it can be new hires. And it can be part-time or it can be full-time. So it's still very flexible for you. These are some of our apprentices stateside. And we have 2 apprentice occupations stateside right now. One cyber first responder, which is available here now, that helps reduce the organization's cybersecurity risk by assisting with threat and monitoring, helping you with your policies and incident response. And then telehealth navigator and that is to maintain telehealth services. And we can bring this one as well and get it registered here in USVI if anybody's interested in that telehealth navigator. But both of those are trained foundationally to manage your day-to-day network administration and security. So really the first one, cyber first responder, it's open to healthcare, but it's open to every business sector. We would like for every small and medium-sized business to use this resource to make sure that they're protecting themselves and also improving their efficiencies with IT for their company. Next slide. Quickly, this is just our enrollment from July 2021 through December 2022. We had 1,420 people that are enrolled. We're in 48 states, not Montana, Wyoming, and 3 of the 14 territories. The 13 people you see there, they're the practice administrators. We also have a group of people going through data science right now with Dr. Luciano. That's also part of this, but they didn't sign up by the December 2022 cutoff date, so they're just not in these metrics right now. You can go to the next slide. And that is it. So if you want to follow us on LinkedIn, where we always put up other resources and things that we have available, that's a top QR code. We also have a YouTube channel, and we have a lot of USVI videos on there, as well as other work that we do in underserved and rural counties stateside. So that would be great if you could follow us there. And I'll turn this back over to David.
And the other QR code that you have there is just let us know which of these resources interest you or you think would be most useful for your organization so we know where to focus our attention. If you want to give us an anonymous response, that's great because we can still use that information. If you want to use this opportunity for us to contact you, just put your name and email with it. We will be here the remainder of the day, and we sincerely appreciate the opportunity to be here, share these resources, but also tell you about what you as a community have told us that you need. And so we just wanted to make sure that you heard those things. And thank you so much.
Thank you.
I don't know if you saw at their table, they had the snazzy silver giveaway bags, but what was a little cooler was the Madras necktie. I think it's a necktie, right? Yes. And the pocket square. Oh, you guys might need to help us with the sock game. Maybe a Madras sock. The ideas will keep flowing. I know that everybody's kind of toasted and ready to end when we said we were going to end, so I'm going to keep us moving. We're going to move into breakout sessions right now, so listen closely for your breakout area. Our first breakout session, Medicaid MMIS Provider Portal Deep Dive with Gainwell Technologies and with Director Smith from Medicaid. You're going to be in Gainwell's room on this main level in the back. So again, that's the MMIS Provider Portal Deep Dive in the main floor at the back. Telehealth transformations in patient care. In our exhibitor space at the back of the room, you'll be with Dr. Maria Wanda and CEO Comisión from Schneider Regional SMRC. Telehealth transformations in patient care and pharmacy. So again, that's in our exhibitor hall at the back. Our third floor is cybersecurity for your practice. This is a virtual presentation from CISA, just going on a deep dive with Mr. Oliveras. Then right here in the main area, driving to results, RPM and CCM programs, DigiMed. And then on the second floor, data-informed, people-driven decision-making, Department of Health with Assistant Commissioner Ruben Malloy and his team, and Dr. Ellis. So again, I'm going to go through these one more time. So we'll start with first floor level, Gainwell, and Medicaid out the back behind me. Telehealth transformations in patient care and pharmacy. Learn about the partnership between Schneider Regional and Howard in the exhibitor hall. Third floor, cybersecurity in your private practice. Main floor right here, driving results, RPM and CCM programs in the USVI. And on the second floor, behind the cafe, data-informed, people-driven decision-making. So please proceed, because those sessions end around 11:35, no later than 11:40. And then at 11:50, we get started with the second round of breakouts, financial sustainability for hospital and clinics with Chartis, billing and revenue cycle for telehealth using SDOH-Z codes with Chem and with Boyd. Then public health unwinding and free upskilling for your practice, learning again about Howard's programs. So please feel free to make your way to your breakout area, exhibit floor, Howard and Schneider Regional, back room for all things Gainwell and MMIS, third floor for cybersecurity, right here for driving results, RPM and CCM programs, and second floor by the cafe for data-informed, people-driven decision-making. Thank you, guys. We've got guides right here, so if you need to figure out how to get to the second and third floor, please meet us here by the stage. And again, by 11:40, we're going to be switching up and jumping into our second set of programs at 11:50.